Hi, everyone. Thank you for joining us today. We're having one more in our series with Dr. Colin Gundling. This one is When Our Body Needs a Little Pick-Me-Up. It's on bracing and footwear. We're currently recording, so I will try to keep everybody muted until the end of the session. If you have questions, you can unmute and ask then. Otherwise, you can also put them in the chat function, and I will just read them at the end. But with that, I think I will hand things off to you, Colin.
All right, great. Thanks a lot, Corey. Thanks for having me again for this. It's always a nice thing to do. I'm sure some of you have been in on these calls before. I recognize some names. For those who haven't, what we've been doing for the last almost like a year plus, right? Like year and a half, I guess, at this point, is here and there we try to get together, and I put together a presentation on some information to just kind of help people understand the orthopedic and physical therapy world of care a little bit better, and understand things like common questions that I get when I'm in the clinic from patients, so that I can kind of help them help some general education across the community with these things, because they're common misconceptions sometimes and things that people just don't understand. And I think if people understood these better, they would be able to better help themselves in their own healthcare management. And these days in the healthcare world, you really have to be your own primary care practitioner. You have to make a lot of decisions and understand where to go, who to see, and understand that when you're getting advice that seems to make sense, and understand when some advice that you're getting you just want to ask more questions about. And it's good to be an educated consumer. And sometimes that includes even some internet searches, which a lot of times patients will be hesitant to tell me, I looked this up on the internet. But that's okay. I mean, I would rather them come with some education and understanding than come and not be an active participant in their care, because those people that are not actively participating in their care are unlikely to get better. Whereas the ones, even if they start with some misconceptions, if they're at least actively participating in their care and willing to listen and willing to have some conversations on how we can change their approach, then they're the ones that are going to have potential to get better. So that's kind of my philosophy in general, but trying to look at it from this perspective of bracing and footwear, it's another thing that is oftentimes, people end up thinking, people have some misconceptions about bracing and footwear, I guess we'll say. And so my goal is to tell you some things that are good about it, some things that are bad about it, and how you can best apply it in your life to move forward with it. So as Corey already said, you can shoot any messages you think of as I'm talking into the chat function. I do have it open on my window, so I can try to answer them as I go, or I might just wait till the end, depending on where they link up to what I'm talking about here. But I do enjoy having a little bit more of a conversation with this stuff, so feel free to ask anything that comes to mind, instead of me just kind of talking the entire time, which I will also do if you don't stop me. So we're talking about here bracing and footwear, and to me, footwear ends up being a form of bracing anyway. So it's really all just bracing, but footwear is another type of bracing, and it can be used as to protect your foot. Okay, so if we want to look at in general why we end up bracing things, it's important to understand the difference between internal versus external support, right? So you see these beautiful buildings. I'm guessing, I think that's Dubai. I put it together a while ago. But on the left were those beautiful buildings, and they all have really strong internal support. So they're supported from the inside with the structures that are on the inside, whereas building on the right there is falling over and being held up by those external support poles. So in our bodies, the use of external support, so the use of external bracing assumes that there is a fault that cannot be corrected through internal means, right? And this is kind of how it applies in our bodies, that using external support or bracing is assuming that there's a fault internally that isn't correctable. Now, that doesn't mean it's never correctable. Sometimes it can be corrected through strength, though. I'm not sure the building on the right could ever really be corrected. I think that's just going to have to be knocked over. And that's important to recognize that in many situations in the healthcare and orthopedic care world, bracing is temporary. And that's something that it probably is the biggest misconception I see amongst patients, is that they think once they have the brace, that's it. And they're wearing it the rest of their lives, whether it's an orthotic or a specific type of footwear or a knee brace. That's just is what it is. And now they just wear braces all the time. And if you are willing to put in the work to strengthen the area, to mobilize the area, to get it working better, very often you can get away from using that brace once it's strong enough and fortified well enough. So, it doesn't always have to be something that is you're wearing forever. So again, I emphasize here that in many situations, the brace is temporary. Braces and shoes both are both forms of external support. So these are things that we're adding to the system to help support it. So some reasons as to why we might put a brace on someone, right? Assuming that there is an internal fault that can't easily be corrected, then that is a good way to quickly correct it. So those faults could be from the perspective of weakness. So that's bullet number 2 down here. With a little bit of weakness, we can add some support to take that away. Another thing, and this is commonly and initially especially the main reason we use shoes, is to help support ourselves against harsh environments. So walking on things that can injure our feet, cuts and bruises that can be prevented through bracing. In some ways, you could even extrapolate that out to clothing. Certain clothing can help protect you from your environment, but it wouldn't necessarily call that a brace. But things that are protecting you from new and harsh environments. Now, a key thing to understand here, though, is that we're saying the word new environments. So that is just kind of getting back to the idea that I've talked about in prior discussions about how our bodies are really good at adapting. They adapt slowly, but they're really good at adapting. So if a new environment is something that your body is not yet adapted to, therefore it can break down in response to exposure to that environment. And one idea with that is, like I've talked about a number of times, the difference between calluses and blisters. So if you just go out and walk barefooted for 2 miles on pavement, you're probably going to come back with some blisters, and that is not a very good adaptation. But if you start walking, 2 miles in your regular shoes, and then you start decreasing how thick the footwear is that you're using slowly over time, or you start walking a little bit longer each day, barefoot, then you end up developing good calluses that are something that can withstand this environment that otherwise would have been harsh to a foot that was not exposed to these stresses. But as it's exposed slowly over time, it can develop some protective measures. So that's why I emphasize new environments. And that can be the same for exercise and fitness and different ways you would potentially challenge your body. So we've got the environment, we have weakness, we have biomechanics, and so it can be used to correct significant biomechanical faults. Now that's something that's important to understand, because we like to think that some of our bracing is really correcting faults, but really the only ones that truly kind of correct faults are like some pretty heavy duty braces. So like the Arizona brace is one that is a pretty heavy duty brace that basically goes around your foot and it completely encapsulates the foot and doesn't allow any movement right or left. Like those are the ones that are truly going to correct biomechanical faults. Putting a knee brace on that's made out of like neoprene and elastic isn't going to correct any biomechanical faults. even putting an orthotic in your shoe, that's probably not going to correct any biomechanical faults. The body's going to kind of move the way it wants to move and is set up to move in spite of some of this bracing. The biggest thing that these braces potentially do is put some different input back into the system to help support things a little bit more. Like the classic example when it comes to orthotics is pronation and supination. So whenever someone has said that they have flat feet, they have a foot that is pronated and it's very flat. So when they we end up saying, okay, we better put a brace under their foot to help support that flat foot. So we put an orthotic in that has like a high arch. But realistically, that takes a lot to change how much their foot's pronating, and a lot of flexible orthotics are just going to collapse under the weight of the individual's body. But it does help with pain and symptoms oftentimes. So if it's not correcting a biomechanical fault, then what is it improving and what is it changing? And really what it's probably doing is helping, with that bullet point above that we talked about, that weakness. So it's helping to add a little bit more spring back into the arch to help give some of the muscles that help that arch move a little more support. So I think this is probably the most common reason why people think we get braces, but it's probably the most uncommon reason to actually get the braces. So it's probably the most uncommon reason that braces help, I guess is how I should put it, that you're correcting some sort of biomechanical deficit. Next up is injury. And this is where I use it the most often. So it's used in the face to provide some short-term relief to irritated tissues. So it's not a forever thing. You put it on and give the individual, I was trying to find a color that doesn't look awful here. How about that? Try to help the individual take some pressure off of these structures that are a little irritated and painful. And whenever we use them, it becomes painful. So it makes sense to take some weight off of them, take your everyday activity weight off of them to give them a chance to breathe, give them a chance to recover, and then you build up from there. And again, another reason is new activities. So we're kind of talking about that environment. So to decrease that tissue load during the adaptation period, during that initial adaptation period. And that's something that, so say you were going to take up running all of a sudden, right? You would probably try to wear a pair of shoes that has a little bit more support if you're pretty weak otherwise, right? You're doing like a couch to 5K exercise program. So in that case, you should probably consider getting some good supportive shoes. Whereas someone that runs a lot and has good foot strength and good awareness of some other things they can do can get away with shoes that are much, much, much less supportive because they've developed some tissue tolerance, whether it's in the skin tissue or the tendon tissue, ligament, bone, like all of that tissue is stronger in those individuals, so it can withstand more load. So that is something to consider when you're taking on new activities. If there's something you can do to take some pressure off of the structures that are going to be more irritated. That being said, the best thing is to really just continue to take it slow when you take on new activities. So to preemptively brace something might not make as much sense as just following a good training program that is allowing the body those opportunities to adapt. So there's some reasons why, the main reasons why we would use bracing. The next thing that I want to talk about is a key question for this is the prescription duration. So is the deficiency something that can be overcome internally is a key question that we ask, which means like, okay, if one of these issues up above here, environment, weakness, biomechanics, injury, or new activities, is something that we can slowly over time build more internal support and slowly take away the external support, then that's what we'll plan on doing. Now, there's certain individuals and diagnoses that external support or internal support just won't come. whether they have weakness, say it's a status post-stroke patient, that they have, that they're just not going to get back any more strength in their foot. So they're always going to have what's called foot drop, where their toes catch as they walk around, and that increases their risk for falls. Then we'll put a brace under their foot that keeps their toes up. And that's probably for them just a kind of a forever thing. So there certainly are these cases where you have like neurologic deficits where strength just isn't coming back. So we need to brace it and appropriately move forward. But very oftentimes it's something that can be overcome internally. So what we need to consider with these, we've got in the next two sections we're going to move into with those considerations in mind here, why we brace, and is it something that can be overcome internally? We're going to look at footwear considerations and then brace considerations. When we look at footwear, something that we need to understand is that there are so many different shoes out there and even subsets of different shoes, right? You have running shoes, but then you have running shoes that are maximalist, like a lot of support, minimalist, no support, big drop from heel to toe, meaning they're basically like the heel is higher than the toes, or that's the traditional running shoe model, or that they're no drop from heel to toe. You've got something that's called motion control shoes. I mean, it is all over the map. And you can see that this spectrum here is kind of showing where these shoes might fall from a support perspective. So down low here at the minimalist side, it's very minimal support. A true minimalist shoe is just north of barefoot. Basically, you have maybe like a thin layer of rubber under your foot, and that's it. And then they kind of slowly travel up the spectrum to a neutral shoe, which is cushioned, so you have some foam in there, some nice cushioning, but there's no extra stability added to the shoe. So there's very little plastic. It's just kind of the foam, some rubber, the upper of the shoe, and that's it. Then you move into stability, which is the most commonly sold type of shoe, a stability shoe. And that is something that has a little bit of support on the heel. So a little bit of plastic added in, and then it helps just support that movement of flat foot, which is pronation, where the foot drops inward a little bit. Then you've got Maximalist, which I put in parentheses here because it can kind of fit on different parts of this spectrum. It doesn't necessarily, basically the definition of a maximalist shoe is that it's a really, really thick sole of the shoe. So that's something that you need to, let me see here actually. Sorry, I just want to see about if I can switch screens here and just look up a maximalist shoe for you guys, so you guys can get a picture of what that looks like. Can you guys see my like Google search? If not, someone say no.
Yes, we
okay.
can see it.
Great. So you can see here, this might actually be a pretty good little picture. 7 best maximalist running shoes. So you can see how thick these soles are on these shoes, right? They're really chunky, thick soles that we're dealing with. So that's something that is pretty, that you can have some extra plastic support in these soles, or you can have no support. So that means it could be a maximalist shoe with some stability added in, meaning some extra support from the shoe, from the plastic, or it could be a maximalist shoe with like a more of a neutral platform where it's just kind of the foam. So this is where things get a little funky with this stuff. All this to say that this is how confusing the footwear world is. And I intentionally kind of add these details to you to kind of get your head swimming and spinning a little bit on this, to then say, really at the end of the day, they try, like, I really believe that shoe companies make it more complicated than it needs to be. And fit is the key, regardless of foot type, regardless of like distance walk, all this stuff. I mean, how the shoe fits and how it feels when you're walking on it is the key. And there's some evidence that shows that improved comfort initially will predict how well the shoe works for you in the future as far as injury risks and things like that. So basically, go to the shoe stores, try shoes on, see what feels right for you. You know, get a little bit of insight from the people that know a lot about the brands of the shoes. But I would try not to get too hung up on the all this like support talk, maximalist, neutral, minimalist, control, because it tends to get a little murky and confusing as we get deeper and deeper into that. So feel how they work for you, and then you can hopefully find ones that work best for you as far as just the fit goes. So when we're talking about shoes, again, one thing that is important to understand is the life expectancy. So this can be activity dependent, but for EVA foam, which is the most common foam used in like running shoes, it lasts for about 500 miles of running. Now, it is something that has kind of a shelf life. So even if you're not using it, the foam kind of degrades slowly over time, just like pretty much anything really does. So if you have a 10-year-old pair of shoes that you have never run in, I wouldn't just assume that they're just as good as new. There's probably some breakdown that's occurred in that foam. Now, something to consider with respect to the foam is that there are different types of foam. So the different types, so you have that classic EVA foam, which is the classic running shoe foam. You also have it's called I think it's an Adidas product. It's called Boost foam, which is basically little foam balls that have been found to give a lot more energy return. So, and I'm trying to recall the numbers as I'm talking here. I believe so. EVA foam gives an energy return of about 60%. So if you jump and land, 60% of that energy that goes into the ground will recoil back into your foot to give you the ability to jump again. So you'll get about a 60% boost in return of energy, whereas the Boost foam is somewhere around 75% return in energy. And then you've got, which is really cool, but the problem is that the EVA foam is pretty light, whereas the Boost foam is heavy. So it adds weight to the shoe. So one thing about, if we're talking about running specifically, the heavier the shoe, the more you weigh, the harder it is for you to move faster. So weight is super, super important for running speed. So a heavy shoe that gives you a good boost in return kind of doesn't even out for you. It probably just kind of neutralizes the effect of the extra boost from that foam. And you may be thinking as an aside here, like, why is he talking about running shoes? I don't care about running. It's important to understand this because really, like, if you're going to go buy a pair of shoes, you might as well just buy for walking, for any like comfort. I would just encourage you to look at running shoes, because that's realistically where they put all the research and the money, and they're kind of the better made, longer lasting options for you. So I would encourage you to look at running shoes if you're going to look at shoes. And this kind of side topic of the foam is kind of important to see that there are different types of foam in the shoes, but the key is that we need to understand that the foam only has so long to last, and the EVA foam doesn't last quite as long as the Boost foam. I think they claim, something like 800 miles for the Boost foam, somewhere like it's a good bit more. And then Nike came out with a foam that is in their new running shoe, which I'm blanking on. What is it called? But basically this foam is light and gives like an 80% return in boost. So it's super light and gives you a big return. And that is how it was one big contributor to someone being able to run marathon under 2 hours. And so that was like a huge step forward in shoe technology. So shoe technology is still on its way up and improving, but at the same time, don't get too worried about all the complexities. Just try on the shoes, see how they feel, understand that they will wear out, the foam wears out, and that it's probably good to exchange those shoes if you're using them a good bit for another pair of shoes every once in a while. You can change them to like your grass cutting shoes or something like that. That's fine. But shoes that you're just walking around in, you want to get a little bit extra support out of as you go throughout your day. So moving on to some different brace considerations here, I just kind of picked the different body parts where we commonly use braces and can kind of talk about those. The foot and ankle is kind of the most commonly braced area, especially if we look at orthotics, right? So orthotics are commonly used brace for the foot and ankle. We end up, you can buy them over the counter, or you could get them made specifically and specially for you by a podiatrist, a physical therapist, chiropractor, or you could go to like the Good Feet store and they might make them for you. But unless you have like a specific biomechanical abnormality in your foot, most of our evidence says that buying a custom-made orthotic that typically costs anywhere from like $300 to $500 is really just probably not worth it for you. Getting an over-the-counter orthotic will give you just as much benefit as getting this rigid. Getting this custom-made orthotic. So that's something to keep in mind. Yes, orthotics are important, but trying to get ones that have as expensive as possible investment in them. Basically, the more money you put in doesn't result in more improvements out from that. So understanding that you can get a lot out of a over-the-counter $40 orthotic is, and then as you go to your physical therapist, we can add different things to that orthotic, whether it be bracing or little pads to help treat these specific conditions that you can see below, like turf toe, metatarsalgia, which is pain in the ball of your foot, your bunion, neuromas, and different things like that. So these conditions I threw on here just so you could see and say, oh, I've heard of a neuroma. Like my doctor said I had one of those. What type of orthotic could help with that? And that's something that you could look into, talk to your PT, talk to your podiatrist, and maybe get a little bit more information there. Not necessarily going to go through all of those specific conditions today, but the bracing in the foot can help with those. Then looking down at the knee, we have I-spine. There's a question here that I can read real quick. So we're talking about the back. So we'll get there when we get to the back. Okay, so knees, light bracing can change pain significantly and will not weaken muscles. So that's important to understand with the knee braces. Oftentimes people will cite, I don't wear braces. I don't wear the brace because I don't want my knee muscles to get weak. I don't want to weaken it. That's really not the case. At least in the knee, we can see that studies where we put a brace on people with arthritis versus a group of people with arthritis that doesn't have a brace that don't wear braces over the course of a year, both groups have the same muscle strength in their leg. In fact, the study that I saw, the group that wore the brace wasn't statistically significant, but had a little bit of an improvement versus the group that didn't wear the brace. And really, when you think about it, that makes some sense because the brace is putting them in less pain. Therefore, they're probably more willing to use that knee. And as they use it more, those muscles have potential to get stronger. So that is something that can't be ignored, and that can be a great way to get you off of that painful edge and get you doing more. And as you do more, you strengthen more. And as you strengthen more, you change the loads in the knee so that hopefully it gets a little bit healthier. Then we can move down to the back. So there's some different ways to look at the back. You could brace the back itself. You could wrap that around in like a corset brace, and that can be used. But if they're used long term, that can tend to increase muscle weakness in the core. That can tend to replace some of those muscles in the core. They do have belts that are a little bit smaller. They're called SI belts that have not been found to lead to weakness in the core. So you could consider using those instead of the big heavy duty braces if those give you some relief. Now, not to say that those braces aren't helpful, because back braces can be helpful in the short term. It's just, by short term, I mean like maybe a week, and then you've got to start moving and moving on. So there's the question with respect to spinal stenosis with balance issues. Should I wear clogs or shoes that do not have back to support the heel? And when it comes to, okay, so spinal stenosis, the first thing that I think of is if you do have spinal stenosis, you probably don't want to wear like high heels. So high heels, shoes with significant heels, and you might not, you probably aren't wearing stiletto heels with spinal stenosis, but even clogs have a higher heel than the forefoot. So you've got to be aware of shoes that really have big chunky heels and not as much in the front, because that results in putting your hips in a position where it could put increased pressure on your spine. So I'd be aware of the heel size in those shoes, not necessarily whether or not you have support in the back of the heel. And then from the perspective of balance issues, if you have, it gets back to kind of what's the makeup of the shoe. So the foam, right? So if you have balance issues and you're wearing like you said clogs, like Crocs, for example, that are kind of a really light foam, those probably aren't great for balance issues because they don't give you a lot of input back. It's basically like you're standing on a foam block. And if you've ever been to PT, we love to have people stand on foam blocks because it challenges your balance so much. So by putting just a foam block under your foot all the time, you're actually increasing your risk for falls. And I remember a number of years ago, I think Skechers came out with shoes that were intended to like tone your like buttock muscles as you walked or something. I forget what they were called, but basically the heel of them was a really, really squishy foam. And patients that had balance issues would wear them a lot, and it would increase their risk for falls because these shoes were basically like standing on this really, really compliant piece of foam all the time everywhere they went. So just be aware of how the shoes are made up, like what the material is. Generally, it's better to have material that is a little bit more firm if you have balance issues. But you can also use, a number of people will claim that orthotics, just regular orthotics, can help for back pain. And yeah, I think that there are certain cases where that could be helpful, but it's not the home run technique. I mean, really, you've got to strengthen and move the back is the home run technique. And then anything else you can add on top of that might help get you a little bit better. So say you can strengthen and move the back and you get about 70% better with that, then maybe you'll get 10% more from an orthotic. Maybe you'll get 10% more from using, I don't know, traction. And slowly that can add up to a significant amount, but it's not the home run for back pain when it comes to wearing footwear as far as a brace goes. When we're talking about the neck, typically the only time you're going to see any benefit from a brace is post whiplash. You can use a soft collar and it could give some short-term beneficial effects, but using a firm collar is really something that isn't recommended much these days, and it can actually lead to a prolonged recovery. So it can lengthen that time of disability after the injury. So that's something to be aware of. You really want movement. You want to get that neck movement moving. The shoulder, I mean, you can use a sling for like ligament sprains and things if you fall onto the shoulder. Typically, we don't recommend much bracing for rotator cuff injuries. You want to get it moving and get that moving as much as you can within a pain tolerance. Post-operative, though, you would probably you would be in a brace for a few weeks, but after just a regular rotator cuff strain or even a mild tear, we want to get your arm moving as much as we can. Looking at the elbow, there's some injuries that can be really lingering in the elbow, like golfers or tennis elbow. That's pain on the bone on the outside of the elbow or pain on the bone on the inside of the elbow. And some braces can be helpful for those, for sure. They can help take some pressure off of that attachment point of the tendon on that bony point and allow you to get back to activity. So it could allow you to continue to golf or play tennis or work at your keyboard or whatever is your problematic issue with regards to this elbow pain. Wrist splinting can be used for carpal tunnel. It can especially help with carpal tunnel issues. People get night pain quite often. So if you splint at night, it can help control those symptoms a little bit and slowly take pressure off of that area to give it an opportunity to heal. Similar idea with the finger. Short-term bracing can help reduce pain in acutely injured areas. So like these are some common issues in the hand, and if you've had them, I might know what they are. If not, then I wouldn't worry about it. The hand gets relatively specific, but just know, there are some opportunities to use short-term bracing in the hand. Compression garments it's not quite bracing, but it's the most useful tool for the most useful diagnosis for that is using it for muscle strains and muscle injuries and muscle fatigue in the extremities. So you can put on, if you do a hard workout, even putting on a compression garment afterwards could decrease your muscle soreness that you might feel. But then also just compressing around that muscle can help feel good if it's strained, and allow you to do a little bit more with that muscle too. So those can be useful in those situations. Compression garments also are very useful for lower or swelling. So they can be helpful for swelling too, whether it's like a true lymphedema issue or something that is injury related. Last thing that we can talk about here would be the use of tape, which I do use relatively often in the clinic as like a precursor to considering bracing in the area. So if we can put the tape on and you say, oh yeah, this feels good, like it felt a lot better, I think I can do more with this tape on, then we may consider, okay, this brace might be beneficial for you, just because it's a lot easier for you to put a brace on than for you to put tape on. So if the tape helps that I put on, then I may say, hey, why don't you look into buying this brace or that brace? Then another thing to consider with the tape is that there's different types of tape. You've got static tape, which is a like your classic white athletic tape, and we have this thing called leukotape here, which is like super sticky white athletic tape. And those don't move at all. They stick to your skin and there's no stretch in them, versus dynamic tape, which has a big stretch, and that can help. They have different applications in our clinical world, and that's something that you should just kind of talk to your healthcare practitioner about which one makes sense for you. And I oftentimes do teach people how to do taping techniques at home on their own. If we can't find a brace that is just as effective, then you can certainly buy some tape and do it on your own. And really, not many of the techniques are so complicated that you wouldn't be able to pull that off. So bracing through tape can be an effective way of doing some bracing for yourself. This is that bracing is often like gives you short-term benefits. Really, we've got to strengthen to overcome the need for braces quite often. So I'd encourage you that if you find benefit from a brace, then try to understand why it's helping, like what it's helping, and see how you can replace that brace by strengthening certain areas. And that would go a long way for the long term, because really, like especially with orthotics, I've seen some indication in the evidence that they really only have a big beneficial pain reducing effect for about 3 months of wear. And then after that, the body adapts to them and then can cause pain to come back if you haven't been strengthening. So trying to really work on strengthening along with these orthotics and braces and whatever you're doing is the key to preventing issues long term. So that is all that I have for you guys today. This is our information. We have 2 clinics, one in Penn Hills and one in Murraysville. I'm at the Murraysville office, and you don't need a referral to come to physical therapy. And we're happy to answer any questions you have. Beyond that, you can shoot me an email if you have any questions. And but please ask any questions you might have in the chat here today, including any suggestions for future topics, because I think this is the last planned talk that we have, maybe, Corey. And so we can either plan to restart what we have done and start from the beginning, or we could add some things on based on what people want to do. Yeah, it looks like it is the last planned talk. I just checked. So please, any ideas or thoughts are more than welcome, and we can open up some discussions on those. So I think I'm done talking, unless anyone has a question.
You can email Colin. He has his email address in the chat, or you can email me. I'm going to put mine in there right now as well. Yeah, so if you have requests for particular topics that you would like to see in the future, just let one of us know and we can discuss those and hopefully be able to present something with that. But if anybody has any questions, they can put them in the chat function. If you prefer, you can unmute yourself and ask it, but you can type in the chat function. We should be able to see it right away. I have a question. Since bracing is temporary and the focus is on strengthening while using the brace, how can you tell when you're, overdoing it? I mean, is it just general pain? Do you have to be especially cautious when building that strength?
Yeah, so it depends on the reason you're bracing, I guess, because if you're bracing because of an injury, that will give you some feedback. If you're pushing the injury too much or the injured area too much, then it will give you pain as a feedback on that. Whereas if you're bracing more so because of something from a just true weakness perspective, then you might not get as much of a painful feedback. But what you might feel more so is just that you don't feel as supported. You're not able to move the way you want to move. But the struggle with that explanation is that if you have something that's a big support and you take it away, almost no matter what, you feel that way. You feel like, right, what have I taken away? But I guess pain would be probably the biggest feedback you're looking for in those cases. And if you've got to kind of think about some principles of exercise for how slowly you build up that strengthening. And it really does take time. I mean, bracing, you can plan on probably using in certain cases for 2 to 3 months. And then if you're strengthening that whole time, the strength training should be able to take place of it around, 8 weeks out. So around 2 months out. And so you're looking just for time of working on it, most likely.
Okay. That would apply to back pain, like SI joint kind of things, or? Yeah.
And there's certain, like with back pain, it's a little tough because there's not, and actually with any condition, there's like bracing isn't something that's guaranteed to work. If you find some bracing that does help, then use it when it seems appropriate. If you're going out to the mall and your back is going to scream at you, then throw it on. And that's good, but try to otherwise work on strengthening and fortifying the area. A real utility of bracing is to prevent slides backwards, I guess, is a good way of thinking about it, right? So you're strengthening and moving the area, but and you're feeling better, but you have to go do something that has potential to cause irritation. Then in that case, throw a brace on, because that could prevent the irritation and prevent any backslide for you. So that's something to consider with that.
All right, thank you. Any other final questions from anyone? All right, then. I think we will wrap up for today. As we said, if you have other topics you'd like to see revisited in the future, please send one of us an email. And I thank everybody for coming today, and thank you for your time, Colin. As always, it was great.
All right. Yeah. Thanks a lot, everyone. Thanks for listening in, and maybe I'll see you soon.
Have a good day, everybody. Bye.
Bye.